is up, energy's up, and so are we.
Greet the day's smile and say, Good morning, City!
This is The Vibe with Maalika on Radio 44.
A very, very good morning. Welcome aboard. It is Monday, the 23rd of March, 2026, right about now. And we are very excited because it is World Optometry Day. And you know what? This year, the World Council of Optometry has rolled out a very particular theme, a shared vision, collaboration in global eye care. That's the major theme. And here's the lowdown, really. You know, a shared vision. It's all about collaboration. The World Council is saying that optometrists, they aren't just the people who sell you glasses, right? They're the front line of the entire health system when it comes to that all-important part of your vision, of who you are, of what you're able to see in this world. So the mission is to integrate eye care into general healthcare, really. So today, I'm super excited to be joined by Sushil Kumar, the Chief Development Officer at Lions SightFirst Eye Hospital. And of course, it's located in Loresho. They've got outreach clinics also like in Islay, in Southfield and more. And he is a senior optometrist, by the way, qualified from All India Institute of Medical Sciences. He started practicing in 1988 in Southern Africa, and he's also the founding chairman of the Botswana Optometry Association. He's a recipient of Long-Term Service Award by Optometry Association of Kenya and the ex-managing director of Essilor East Africa. And of course, right about now, he's here with us. Welcome, Mr. Kumar. How are you doing today?
Good morning, Maalika, and the listeners. Thank you for having me this morning as we commemorate World Optometry Day.
All right.
Thank you.
So we have so much to get into. You need to stay right here. Before that, obviously, I'm going to be playing you a song about eyes. It's just, I can't not use this opportunity. Right there, Akia Gulab meets Mwaki coming through on Radio 44. Good morning. I'm Maalika, keeping you company, and joining me in studio is Sushil Kumar, the Chief Development Officer at Lions SightFirst Eye Hospital. Today being World Optometry Day, let's dive right in. So Mr. Sushil, how does this year's World Optometry theme really work? A shared vision, collaboration in global eye care. And of course, at Lions SightFirst, the core mission, how does it all align together with this?
Thank you, Maalika. This year's theme, a shared vision, collaboration in global eye care, it perfectly mirrors with our commitment at Lions SightFirst Eye Hospital to work with global partners and local communities to eliminate preventable blindness. This year's World Optometry Week highlights how critical collaboration is to ending preventable blindness. LSEH embodies this theme through its partnerships. Our mission aligns by integrating optometrists, ophthalmologists, ophthalmic clinical officers, ophthalmic nurses, and even mid-level ophthalmic workers into one ecosystem. Our shared vision ensures that a patient isn't just seeing one specialist, but is part of a global network dedicated to affordable, high-quality eye care for all social classes.
Okay, that's brilliant. And there are a lot of people who are not sure how to distinguish between, let's say, an optometrist, an ophthalmologist. How do you differentiate, just for us to understand?
Well, they are different roles. Primarily, an ophthalmologist is the physician or the surgeon. Yeah, and then of course, because we need to see so many patients and they need to be channeled properly, there's a lot of diagnostics involved. There is a lot of screening that is required. So at every tier, we take care of them so that, when they get to the specialist, they have already been screened and a lot of the pre-work has been done. So we could concentrate on the core business of treating those patients.
Amazing. And how rare is it to see somebody with 20/20 vision in today's world? Because we're so focused on our screens constantly.
20/20 vision is still very much there. A lot of people have their vision 20/20, but I think it's a bit of a myth now. A comprehensive exam is still very vital. Even if you have a 20/20 vision, because you have some silent killers like glaucoma, which has no symptoms in the early stages and can exist even if you see perfectly. You have even retinal health to be taken care of. So an exam checks for tears, holes, thinning of the retina. I think these are critical components. Also now the digital strain.
Yeah.
So in a world of screens, an optometrist provides ergonomics and preventative advice to keep that 20/20 vision for life.
Amazing. And could you elaborate on the range of specialized services that, of course, we see at Lions in terms of providing beyond that standard eye exam?
So our hospital is a leading tertiary facility providing advanced interventions like surgical, for example.
Yeah.
With the specialized cataract surgeries, including phacoemulsifications, corneal transplants, and glaucoma management. Even in pediatrics, we have a dedicated department for children to treat congenital cataracts, strabismus, which in easy language is called squint, and retinopathy. So we also have a very successful vision screening programs for schools called Sight for Kids.
Okay.
And for diagnostics, we have advanced imaging like OCT, visual field testing, fundus cameras, etc.
Amazing. And I know you also do quite a few outreach programs, right? So how is it that you're able to reach as many people as possible just beyond the hospital setting?
That's correct. So LSEH takes eye care to grassroots. Through our rural eye camps, we deploy mobile clinics to remote areas of Kenya to conduct screenings. And also patients that are identified with surgical needs like cataracts are transported back to the main hospital in Nairobi for subsidized or free surgery. We ensure the right to sight and it's not limited by geography.
That's brilliant. All right, we're going to keep going with this conversation shortly, but for now, Gulabi Aankhein playing for you. It is Suniti Chauhan with Aankh. It's all about the eyes right here on Radio 44 today. Good morning. It's World Optometry Day and we are still in conversation, of course. Sushil Kumar with me in studio. And let's dive into treating a patient with low vision, right? At Lions SightFirst Eye Hospital. So how does the support that the facility provide go beyond just that physical eyesight? Because that's one part of it. There's so many facets to our well-being, to independence when it comes to sight as well.
Sure. Maalika, we have patients with irreversible vision loss. So LSEH provides low vision rehabilitation. This goes beyond, of course, the physical sight. So we provide assistive devices like magnifiers and telescopes. We also offer orientation and mobility training to help patients navigate their homes and their workspaces. Restoring independence, which directly reduces the risk of depression and social isolation. So we do provide a holistic cover to patients with low vision.
Because there's a lot that you have to adapt to as well when it comes to different sight issues, and maybe you have reduced vision in one eye and things like that. So there's many facets to it, I'm sure. And what's the importance of having, let's say, good quality lenses as compared to wearing branded eyewear?
Oh yes, that's my favorite. So I always emphasize that lens quality, including the coatings, the UV protection, and the focal accuracy, it actually determines your visual health. So we have a independent state-of-the-art lens production facility called Clear Vision Express that can provide optical lenses within 48 to 72 hours, whereas importing the same lenses requires 2 weeks. So this production facility is also complete with a coating lab. So Clear Vision Express, we've also been appointed as the Kenyan distributors for Zeiss Vision Care. Zeiss is a leading global brand and regarded as the gold standard in optical lenses. So through this distribution agreement, we provide both Zeiss as well as our own high quality, locally produced generic lenses to all the leading opticians, eye clinics, and hospitals. So high quality lenses reduce eye strain and prevent long-term retinal damage from blue light and the UV rays. So according to me, aesthetics are important too. A well-fitting frame that looks good on your face is essential, but that is not all to have the most suitable eyewear.
Yeah, I think when we at first blush, we're focusing on, okay, what's my face shape? What's this going to look like? Because it's such a big part of your personality then as well, when you start to wear glasses. And I've been wearing them since I was very young. Today I'm in lenses, so I can see very clearly. But I think that's also part of the process for many people when they start to have vision issues, the glasses and the aesthetics of it. But like you said, the lens quality is so important, right?
True, very true.
And what do you think about the current styles? Have you seen like the shift? I know at some point everybody had these wild colors, and then before that, instead of plastic frames, it was the wire and the metallic one. So have you seen the trends develop, especially in the Kenyan market?
Yeah, trends are changing very, very rapidly. And we need to keep up with the trends. And of course, Kenyans are very trendy, but then again, it depends on the age group as well. There is now a very big global theme on being minimalistic. So we have a lot of these rimless frames where you see very less of the frame and more of your face and your features is what is being preferred. Currently.
Okay. I think I should try that. I think I'm going to switch out my current frame. You've inspired me. Well, we've got a couple more questions, of course, for Sushil Kumar, the Chief Development Officer at Lions SightFirst Eye Hospital, who's with us in studio. Stay right here. It is the World Optometry Day song playing for you right here on Radio 44. Yes, we are celebrating World Optometry Day and we are still carrying forward this conversation. And Mr. Kumar, if I ask you about how often somebody should get their eye checkup done, for regular maintenance and to just make sure their vision is in the best possible way being taken care of, how often would you say that should be done?
Yes, Maalika. So unless there is some ongoing condition that are being treated, on an average, we would want children to be tested once a year and adults at least once in 2 years.
Okay. So, some of us keep our glasses with us for 5 years, 6 years. We don't know what's happening, if there's any change in the numbers, and then we start to feel that headache. That's when we go in.
But better is to do it at least once every 2 years, so that even if there's minor changes, because the way we use our eyes these days, especially with digital devices, we need very accurate vision.
Yeah. The constant scrolling, it never ends. Now, by connecting World Optometry Week, of course, to your daily services at Lions SightFirst Eye Hospital, how are you hoping to change the average Kenyan's, perception and view of what an optometrist truly does?
Sure. So yes, linking the World Optometry Week to our daily services, we aim to show that an optometrist is more than just a spectacle seller. Okay, they are primary healthcare providers who even detect systemic issues through the eyes, acting as the first line of defense in preventive medicine. That's the perception we want to create. Absolutely.
And I think, when we go in and we have those read the letters and, see which color's brighter, we think, oh, this is just, so simple. This is the only part of it. But there's so much more that they're able to determine through those tests.
True. Those tests that you are mentioning, it's part of the subjective refraction. So we've actually tested through the system. Now we want to make sure what's comfortable for you, what kind of prescription you would accept. Sometimes we find people with very high prescriptions coming in, and to give them that full prescription to wear would actually cause a lot of strain for their eyes to adjust. So we have to go step by step so they can adjust and have a comfortable vision.
Okay.
Yes.
Amazing. We're still right here in this conversation all about your Akia. Stay with us.
Radio 44.
You know what some people consider the ultimate show of swag is wearing the shades indoors at night. I don't think that's the most swaggerific way to live life, but here we are. It is World Optometry Day. We are winding down with Sushil Kumar, Chief Development Officer at Lions SightFirst Eye Hospital. And it's been a pleasure really diving into so many topics with you, sir. And finally, of course, from tiny tots coming in, you know, for their first checkup to you've got older adults needing cataract surgery and beyond at Lions. You know, what's the best part about caring for so many different generations for you?
The best part is the longevity of the care. LSEH often treats 3 generations of the same family. Seeing a child succeed in school because their vision was corrected, or an elderly grandparent regain the ability to read the Bible or the newspaper after a cataract surgery, creates a profound sense of community impact. That is what a leading legacy of 30 years of eye care service to the community at Lions SightFirst Eye Hospital means to us.
Amazing. Thank you so much for joining us today on World Optometry Day. It's been a pleasure to have you with us. And what would you say as your parting shot for anybody thinking that I need to really get my eyes checked today?
There are so many options, and of course we have discussed Lions SightFirst Eye Hospital. Just be regular and get it done. Thank you.
All right, that's your call. You've been called out. You better get your eyes checked today. We will, of course, keep on playing you fabulous music like one of my favorite songs about eyes. It is all about the angel eyes right here.